Welcome to Healthcare Heroes, a podcast powered by NPHub.com.
We created this podcast to highlight the incredible, hard-working heroes inside healthcare.
The entrepreneurs, advocates,
and providers that are saving lives and improving their communities
one day at a time.
These are their stories.
Nice. We're live. I'm very excited. It doesn't get old.
So am I.
This is going to be a good time. So, everyone, we are here with Lynn. Lynn is the CEO and co-founder of NPHub, which is the National Nurse Practitioner Entrepreneurship Network. And anytime you get to combine talking about entrepreneurship and talking about nursing and talking about NPs, I am literally jumping up for joy because it's like my favorite topic to talk about. So, Lynn, welcome to the show.
Well, thank you so much, Krish. I love your excitement and your energy.
I'm trying to get as hype as possible. But I actually do really enjoy getting the chance to talk to I love talking, especially when we talk about business. And we did a podcast prep episode, or not episode. We have a 15-minute call before every guest where we kind of get a chance to do some prep and talk about topics. And whenever the topics start talking a lot about entrepreneurship, I just get really excited about it. And as someone who has invested in their own NP-owned clinic, I think some of the topics that we're talking about today are going to be really apropos for NPs who want to start their own practice, who have their own practice, but they're still figuring it out. Billing, is a big one. Code. It's just there's so many topics involved.
Yeah, well, it's not as easy to start a business as one would think, for sure. And especially when you're a nurse practitioner and wanting to create a practice, it's even more a daunting task.
100%. So, Lynn, let's start off with this. Can you give an intro on who you are? How are you? I mean, not how you are, but how's your day going? But who you are, why should people listen to you, and what's going on?
Sure. Well, I want to thank everybody for tuning in today, and I'm really happy to be here to talk about a little bit about the National Nurse Practitioner Entrepreneur Network. There's 4 of us that are founding the organization, and one is a nurse attorney who actually wanted to start an NP practice in Pennsylvania, and she couldn't find any takers. No NPs wanted to join her. So fast forward now, there's a nurse practitioner who owns her own practice. There's a nurse practitioner who works for CMS. And my background really is coding, billing, documentation. And we have our nurse attorney. So all of us together really recognize that the business brain development of a nurse practitioner doesn't occur in school. And in order to be successful, we have to learn these skills. And, where are you going to get that information? There's plenty of things out there on Facebook, but, how do you know what's good and what's not?
1,000%. There's a million things on Facebook, on Twitter, I'm sure, that you could find, and how do you trust it? So I think maybe we start there. First off, maybe give some context on sort of maybe when you started your business, when you started the organization, and then also how you vet information that's trustworthy.
So we actually started in 2017 with a joint venture with Northeastern University to create a nurse entrepreneurship conference. And originally we thought, gosh, how many people are going to actually show up? We figured maybe, 20, 25 people. We had 100 nurse practitioners who were interested in entrepreneurship. So that really spurred us on to say, hey, I think we've got something here. So from that, we've actually created a member service organization that really provides and tries to reduce the barriers that NPs face in starting businesses. And first of all, the big one is education. So we started a Business Basics Accelerator course. That's a 12-week online course that you can take and learn everything from soup to nuts about starting a practice. So you're learning from content experts too, because it's not just, nurse practitioners saying how they started a practice, which is probably fine, but we actually got a marketing person to do our marketing, credentialing to do credentialing, revenue cycle to talk about that. So we got content expert speakers, and that has really been valuable for the folks that have taken the course. And all the persons that we've had so far that have taken this Business Basics Accelerator course have started their practices, which is very exciting.
Wow, that's pretty impressive. You have 100% hit rate there. So talking a little bit about what you see now, I guess, just so the audience has some idea, how many maybe nurses have you guys helped, served in some capacity or another? Yeah.
Yeah, I mean, basically, we've served hundreds of nurse practitioners, those that are interested in starting businesses, because we do provide consulting services. So, say you have this idea and you really don't know how to get it off the ground, we can help you do that. We can talk it out and help you decide, what route is good for you. A lot of people have great ideas, they just don't know how to operationalize them and get them off the ground. And we do a office hours program the third Tuesday of every month where we really focus on a hot topic, and that's opened up to everybody. And we've had thousands of NPs sign into those conference calls, and they're free. And and we actually have one tomorrow night on RVUs, which a lot of people have trouble understanding what RVUs mean. We've done one on contracting that was fantastic on how to read your contracts and know what you're signing so that you don't get into trouble. We've done one on credentialing. We've highlighted a lot of our nurse practitioner entrepreneurs as well. And those go back all the way to 2018. So there's lots of great information there. You can go back and listen to those recordings as well.
Oh, that's great. So the recordings are on the NPen website?
They are.
Oh,
yep.
Very cool.
So they're free to members, but a small fee for those that are not members.
Awesome. So when you're talking about like some of those popular issues, right? RVUs come up a ton. Credentialing comes up a ton. Billing and coding comes up a ton. So, and talking about your contract, right? I hear a lot of these nurses, honestly, students of ours who've gone on to graduate, come back as preceptors. They tell us that they're on these non-competes that really are not enforceable. If you think about it, like they're non-competes that they'll be, it'll say something like, you can't practice in your current state. And that will be thrown out in court. That just does not make any sense. But how do you, I think maybe starting from any of those three topics really, between contracts, RVUs, or, credentialing, what are some of those mistakes NPs often will fall into that you've seen talking to them?
So I'll start with the contracts first. And you did bring up about non-compete, and we do see that in a lot of contracts that people will have, as far as starting going to an employment contract, and they have this clause in there. And the problem with that is even though you say it's be thrown out in court, I have had scenarios that people have presented to me where they've had this non-compete and they were within the 1 mile radius of that 25-mile geographic location, and actually the employer enforced that non-compete. And the person didn't end up getting the job. So, take it seriously and don't put it in your contract. That's the only thing I'm going to say about that. But with contracts in general, like if you're going to sign a contract with a medical supply company or a lease arrangement with an office, you really need to read your contract to know what the terms are. And our contract person said, consider the terms like you're going to get divorced or the relationship's going to go bad. And how do you want that to end? Because everybody goes in with this pie in the sky idea that these contracts are going to be great and, nothing could go wrong. And something could go wrong. So please read those contracts. And then 100%. Lastly, credentialing. Credentialing is how you get paid. So you really have to make sure that it's done right and correct. And credentialing takes a long time, and the timing is really extended out much longer now because of COVID. There's not as many people doing the credentialing and certifying that. And then there's also issues with trying to keep track of it. The timing, it takes so long now. We're up to like 120 days to get credentialed for some insurance plans. So you have to factor that into your business. If you're going to be doing that, you're not going to get paid for that period of time. So you have to think about that. And credentialing takes time because you have to chase the paperwork and make sure everything's falling into place. So
what do you recommend for NPs opening up their own practice? Do you recommend that they sort of sign their lease, then work on their credentialing, so when they're ready to take patients, it sort of lines up? Or do you recommend they start as a cash pay option? Walk through that first 90 days, 120 days of opening up your practice or starting your business.
So there's a couple of options, but the first thing, as soon as you get your EIN number and your tax ID and everything's all set up in your name, start the credentialing process, because it's going to take you a long time and you can't see patients and bill for them until you are credentialed. So that's kind of the first thing. Even sometimes before you get office space, you might want to
Yeah, I
start
was
to
actually
think
just
about
thinking,
that.
can you get credentialed before you even go find an office? So it's like you start your company in advance, start doing some marketing, start
Yeah.
like doing some promotion and letting people know you're coming soon. You can start your credentialing before then. Oh no,
Yeah,
sorry,
you
right at
can
that point.
actually. Yeah, you can start it ahead of time. You can
Okay.
change your address at some point if you get your, business, your
Mm-hmm.
brick and mortar up and running. But, some people have home-based primary care, or they're going into patients' home where they don't have a physical plant. So,
Yeah.
you know,
Okay.
but the
Wow. So you
credentialing does take a while. So definitely put that on the top of your list as things to do first.
that's that's a nice hack that I don't think a lot of NPs know. The ones that I've spoken with, like I think a lot of people will they sort of go step by step, right? It's sort of okay. They start the company. Let me find my office space. Then maybe let me start some marketing promotion. Let me work on my credentialing. Then let me see patients. But it doesn't. You could actually combine it out a little bit.
Yeah, you have to think about the payment, because once you open the doors, you want the patients to come in, but you also want to get paid for it too. Medicare will go back a bit, but most of the private insurers may not have that grace period. And that's one thing people don't realize, is that you can't bill unless you're credentialed.
That's
And the other
fantastic.
thing, if you're going to do cash, because you brought that up as well, if you're going to accept Medicare, you have to be either all in or all out. You can't have half cash pay and half not. So that's another thing
Oh,
people need to think about.
did not.
Yeah,
I don't. I can assure you, people don't know that. So you're saying that if you want to take Medicare, you cannot do cash payments.
for Medicare patients, right?
Oh, for Medicare patients. Okay, that makes
Right.
sense.
Yeah.
Um, okay,
So
so go ahead.
I was just going to say, so you can't have like one service that you could offer for Medicare that's, you'll bill through Medicare, and the other is a service that you'll provide Medicare patients that you'll do on a cash base. You can't do that.
Okay, so then I have to ask you about RVUs
Hmm.
because it is probably, I would argue, one of the most important topics that most people don't spend enough time figuring out.
Hmm.
Um, there's not a lot of like widespread information on it, and then you get stuck in that sort of thing you had mentioned, which is how can you know you can trust it? So, what is an RVU? Why is it important for an NP to know? Um, and do you believe that they should be measured on that as a metric or not? So, a lot there.
Yeah. So RVUs are relative value units, and each CPT code has a relative value unit assigned to it. And it really has three parts to it. One is the work component, which is what the provider does as far as taking care of that patient. There's a practice component, which is how much you pay for heat, lights. It takes into consideration your electronic health record and all that ancillary stuff that goes into that visit. And then your malpractice. So those are the three parts to RVUs. And each CPT code has an RVU. Now we get 85% because we're nurse practitioners, and you can negotiate some of that with your private insurers, but for Medicare, it's 85%. And it's important to look at your RVUs, because that's how your payment is going to happen. And if you don't have any concept about how that payment works, then you could be jeopardizing the opportunity to get a productivity bonus or some other method of reimbursement for the quality care that you're providing the patients, because you're not aware of that financial contribution that you're making to the practice.
Okay, so a lot there. Talking about that financial contribution, I think that mindset from the 30 to 40, 50 guests I've interviewed for this podcast have always said something like realizing that an NP is really a revenue generating part of the practice. What is
Yes.
you? How would you? Let's talk through that a little bit. How did you figure that out? And how do nurses evaluate their contribution from a revenue perspective to the practice?
That's a great question. And that's one that's often overlooked, because we don't really understand that as part of our business brain development as NPs. During school, we learn about all the clinical and how to take care of patients, but we really don't
Mm-hmm.
learn our financial contribution to a practice. So, one of the first things that you have to realize is that you have to ask a practice, how are you going to bill for my services? Are you going to bill under my NPI number, or are you going to bill under the physician NPI? Because that will tell you who's going to get paid. Is it going to be under the physician or the nurse practitioner? And with Medicare, there's incident to billing where the claim can go in under the physician's NPI, even though the NP rendered the service. The physician is the billable. It goes into Medicare. Medicare sees the physician who provided the service when he really didn't. It was the NP. You get reimbursed 100%, but there's some criteria that you have to meet. And the first one is you have to be under direct supervision of a physician. And how many NPs are under direct supervision? Not many. They have to see the first Medicare patient, so the physician develops the treatment plan. And a lot of NPs see new Medicare patients, so that really doesn't work. The physician has to be accessible in the office, can't be on the golf course, can't be in an endo suite or a surgical center, which is a next door over, but it's a different tax ID number. And then the patient can't have a new problem. So the patient can't have, say, the follow-up is for hypertension, and the patient says, oh, by the way, I have a seborrheic keratosis. Can you cryosurgery that for me in the office? You can't do that under the incident too, because the physician has to change the treatment plan. And they have to have ongoing participation. So the physician could see the patient, the new Medicare, develop the treatment plan, you see the patient and follow up, but the patient has to go back to the physician at some point for that continuity of care. So basically, in the long and short, incident 2 is the physician owning the patient care. And that's a really important thing to know, because the Office of Inspector General is looking at this, and they're looking at this from a fraud perspective. And if you know that they're billing incident 2 and you don't do something about it, you could be held accountable for that, and you could lose your ability to be a Medicare provider. And that would be huge, because that could sacrifice your whole career. And I don't think a lot of people realize that. They don't.
No, yeah, I don't think so either. I think that's really interesting. So then going back to the RVU part of it, right? So let's assume everyone's above board, right? I think we should generally assume that's probably the case, right? Or hopefully. So let's assume everyone's above board. What's the benefit of billing in, say, your name as an NP versus the MD's name? Does that mean, how does a nurse practitioner use their RVU billings as a negotiation tactic to either get a bonus, become a partner of the clinic? How does an NP do that?
That's a lot of information right there in that one question. But from an RVU perspective, I mean, most practices either you have to see X number of patients a day, but that doesn't take into account the acuity level of the patients, where the RVUs do. The RVUs take into account that level of work that's provided, amount of resources that you have to use in malpractice. So RVU should be your go-to when you're looking at a productivity bonus. And when you think about a business as a business owner, there's really, you figure an NP salary is a third. A third is the NP salary, a third goes to the practice, and a third is put back into the business to help, get a new piece of equipment or whatever. So if you think about that salary component of it, a third of what the nurse practitioner brings in goes to their salary, but the rest of it goes into the business. So when you start breaking down how much an RVU is worth, then you start to really understand your value in a practice and how much money you bring in. And then many nurse practitioners are getting disenfranchised with the medical model of healthcare delivery and saying, I don't want to see 20, 25, 30 patients a day. It's just I'm a nurse practitioner. My brain doesn't think that way. I can't run through these patients as quick. And you want to see patients the way you want to. It might be an incentive to say, hey, maybe I should start my own business and do this the way I want to see patients. And that's what a lot of NPs are doing now.
Okay, so let's dive into calculating your value as an NP. Is there a rubric or a quick calculation to figure out how much an NP an NP at a primary care facility, what they're generating versus what they're being compensated? Because I think inherently thinking of being disenfranchised or being maybe being essentially just I don't say improperly or just not properly compensated is one thing that I sort of think about, but actually understanding the numbers involved would maybe make it a little bit more clear.
So each CPT code, so if you're billing a 99213, there's an RVU associated to that. And the same with a 99214, 99215. And by the way, they did change the evaluation and management process earlier this year. So now you do medical decision making or coding by time, and there's lots of ways that NPs can get credit for the quality care that they're providing. Under the medical decision making, they've added social determinants of health, which is really important because we take care of a lot of patients who are homeless. They might be they might have financial situations, they might have food insecurities. So those are things that you can capture within the social determinants of health. The other area is de-escalation of care due to poor prognosis, and a lot of NPs are involved in end-of-life decision-making with patients, and now you can get credit for that. And they've extended the time elements for these services as well. So a 99215 used to be 15 minutes, and now it goes to 29 minutes, and 99214 used to be 25 minutes, now it goes to 39 minutes. And then the 99215 goes up to 54 minutes. It only used to be 40 minutes. So the time values have been extended to account for the time it takes to take care of those patients. So these are some of the things that NPs bring value to a practice that you can now get quality, you can quantify that within a practice and within a visit. So each RVU assigned to the CPT code is there. It's just understanding how to use it.
Is there a template or a framework or an estimate of like what a first year NP generates from a RVU perspective or revenue versus a second year, third year? Does that exist?
Basically, I think what you have to look at is how many patients you're seeing and what you're billing out in your practice each day. So start keeping track of that. So look at your 99214 and know what your RVU is for that and figure that out. And remember, we get 85%. So the RVU is really the 100% reimbursement rate. I did a E&M update as an office hours that has all that information in there.
Oh, fantastic. Okay, if we can try to get that link and add to the show notes, so that way people can learn more about that, because there aren't many people who are talking openly about RVUs. I know John Canyon, he's an NP, he's popular in a lot of NP groups. He talks a little bit about that, but largely there might be a handful of NPs, and there's 250,000 of NPs out there. So I think there's a lot.
And tomorrow night, our office hours is going to be on RVUs, and Cindy Tuttle is a nurse practitioner, and she does a fantastic job going over and explains it in detail on how to do this figuring out within a practice. So I would really encourage people to sign up. It's 8:30 to 9:30 tomorrow night. Just go on our www.nnpen.org website and you can register. It's free. And she does a really, really great job with a huge overview of RVUs. I mean, she's the perfect person to teach this.
Perfect. That's phenomenal. Yes. If anyone can join in tomorrow and find or listen to this podcast, it's going to be, or rather office hours, it's going to be a really good one. It sounds like it.
Yes. Yep.
Very cool. So Lynn, let's pause here for a quick minute. Hello, everyone. We're back. Sorry for that delay with Lynn. For some reason, just having some trouble figuring out how Facebook Live went down again. So we might just have to pause on that whole situation. But before the pause, we were talking about RVUs, which is really exciting. Talking about the office hours you have tomorrow for it, which is going to be awesome to see. What else? What are some of the other struggles nurse practitioner entrepreneurs or budding entrepreneurs are having? So we talk about contracts, we talk about RVUs, credentialing. What are some other things that maybe you could provide a hack or a way to speed up the process?
I think the biggest thing is getting informed, being educated as far as what you want as far as your business. And the biggest thing is getting a business plan and sticking to it. Business plans give you that kind of roadmap of how you're going to roll out your business, what your ideas are, what your marketing plan is, forecasting and how you're going to generate revenue and what kind of services you're going to provide and where are you going to find the patients and all of that. What kind of staff you're going to need. Are there any type of business entities that you should be doing, whether it's an LLC, PLLC, S Corp. Do you need an attorney? Do you need a CPA? And if so, what are the qualifications? You want an attorney that's healthcare focused as well, because there's some nuances in the business world of healthcare that aren't in the regular business world. I would definitely know your practice authority in your states and what you're allowed to do. And from a business perspective, some of those could be a little bit more complicated. So it's really important that you understand what's going on in your practice as well. You don't want any surprises, that's for sure.
So a lot of honestly, a lot of business owners, like let's not even talk about just NPs, business owners, entrepreneurs in the tech space, peers of mine, always sort of like question the need and the value of a business plan, right? Sometimes it's putting too much of the cart before the horse sort of saying, and there's a lot that goes into it. So why do you advocate for the business plan? And what are you seeing are the benefits? Because the cons is it requires a lot of foresight that sometimes could be not needed.
Well, I think in some ways the business plan really helps you to refine and hone in on what you want to focus on as a business, because I think a lot of folks have these ideas and they're different tangents, like I want to do this and I want to do this and I want to do this, and it's like, okay, but let's kind of refocus and reframe and see where we need to go first. What's the easiest thing for me to get up and running? And many people do this as a side hustle, so they have their day job and then they do their business on the side, so to speak, and until they can actually grow it enough to make it their full-time occupation. Mm-hmm. And having that business plan also prepares you for that whole process as well, that growth potential and how you're going to grow. But I find a lot of people have ideas, but they just don't know how to hone it down to something that's actually workable and operationable.
See, that makes sense, right? So having a well thought out plan of how you're going to acquire your first customers, what are the like understanding what are the needs of the market, what are the services you want to provide, and I think in a lot of contexts it's also important what are the services you're not going to provide, right? That people don't always talk about. So one of the things about being your own business owner is that you have the things you're good at, you have the things you want your business to offer, but then at the same time you also have to have confidence and almost be able to swallow the almost like the short-term part of you that wants to take on anyone you can to make sure you take on the right clients, right? So let's not even say you are you're a private practice and you're opening up your own practice. Let's say you are maybe opening up your own service line, right? So you're partnering with a different brand and you're launching your own product. Now, your product is good for certain people. Your product is bad for other people. And I think really being confident about that and letting people know who you're for and who you're not for is so important in your first stage of business that a business plan can help you figure out.
Yeah, you do something called the SWOT analysis, which is
exactly
strengths, opportunities, weaknesses, and threats. And I mean, that really tells you kind of where you need to focus your energies. What do you need to get more information about, or what areas do you need to invest more time and energy in, and those are the things that are important. The other thing is insurance, because I think a lot of people don't realize, if you own a business, you have to have slip and fall, liability coverage, malpractice insurance, all those things. And we're actually advocating for cyber security insurance as well, because, who knows if your EHR can get hacked or something like that. So, those precautions need to be taken.
Yeah, 1,000%. And I think insurance is one of those things where you think about that you don't need as a small business owner. Like we didn't have it for the first year of business, the first 9 months of business when we were growing. And then we realized like, hey, you know what? This is a massive risk. And it's not worth the few $100 that it would cost, right? Because if you're, like an NP already has their malpractice insurance, that already is part of their practice, that's built in. But having additional coverage insurance is so important because things can go wrong, and people love to sue healthcare providers. They love to sue healthcare providers.
Yeah. Well, the other thing too to think about too is that business plan is really going to be your roadmap for what financial outlay you need to get in order to start your business too. Brick and mortar is the most expensive, but house call practice isn't. But knowing your costs really will help to go to that small business to get that small business loan or some sort of line of credit or whatever, however you're going to, finance that business. it's important to
Yeah.
know what your costs are going to be. So your business plan helps you to do that as well.
Absolutely.
So there's
Absolutely.
a lot involved. It's not as
Yeah.
easy as someone would think. And it is time consuming, but it's well worth the effort.
Is that something that's covered in sort of, does NPen walk you through that as well?
So we have the Business Basics Accelerator program. So it's 12 weeks online, and it's done in a way that you can actually still, take care of all the 30 million other things that you have to do as an NP and still devote time to your business. Excuse me.
Oh, good. We should probably both pause for some water. So when you're so sort of like going back to the very beginning of your career, how did you start learning about all the business components of healthcare? Like, what was that story?
Oh, so it goes back when I was a new nurse.
Okay.
And I was working at a local hospital, and our oncology practice decided they wanted to do outpatient chemo. So they said, hey, we'd like you to come to our office and, start outpatient chemo. I didn't know anything about it, zero. So I said, okay, what's the worst that can happen? If it doesn't work out, I just go back to the hospital, pillar of job security, right? Well,
Yeah.
20 years later, I was still in the office. And it really was an eye-opener for me because we learned how to figure out what chemotherapy drug, what diagnosis it would get covered with, what were the supplies that I needed, what were the CPT and ICD codes, and then I would go to the insurance and negotiate the rates. So that's how I learned about that business part of it. So fast forward, and I'm in my NP program and nobody's talking about this. And I said to my professor like 4 weeks before graduation, I said, are we going to learn about CPT and ICD? And she says, what's that? And I go, oh, I think we're in trouble here. So I said, can I do an article with you on the reimbursement process? And that's what we did. I published it in May of 2000 in the Nurse Practitioner Journal, Understanding the Reimbursement Process. And that sort of started my journey to educate nurse practitioners about coding, documentation, and billing. And then from that, transitioning that to, what are the things that you need to know to start up a business? And then meeting up with, Lorraine, Beth, and Sandy. I mean, between the four of us, we really decided that that's what we wanted to put our focus on. We know that nurse practitioners are going to be the primary care providers of the future, and we want them to be successful building sustainable businesses. So that was our mission, was really to reduce the barriers to practice ownership by providing, high quality resources and support that everybody needs. And going back to the business basics, we do have mentorship opportunities afterwards. So you can have somebody that will take you through your first year of business, whether it's an NPen member, or you can actually join what's called the American APN, and they can actually provide you with the mentorship as well. So we have kind of two tracks for mentorship, which is really good.
What are some of the resources so we've talked a little bit about what NPen has, which is fantastic. Talked a little bit about what's not existing in the marketplace. What are some other resources that nurses can go to, either maybe with the AANP or ANCC, or maybe it's other nurses that you follow that are doing a really respectable job on sort of educating people on the business side of healthcare?
Yeah, so I mean, I like to say, start thinking outside the box and look at other stakeholders that can be valuable for you. So the IRS.gov has great resources for knowing how to file your taxes and what you need to do for that. The Small Business Administration has great resources on financing. We have the Connecticut Small Business Development Corporation up at UConn that has a tutorial on everything they need to know to start up businesses. There are a lot of NP colleagues out there that are doing kind of niche, will get you off your feet with house call practices, telepsychiatry, palliative care practices that are all awesome. So, there are some resources that are out there for sure. And one of the things that AANP also has an entrepreneur special group, practice group that also can be a resource as well. So there's definitely resources that are out there. One of the things that NPen prides itself on is that we want to be that community of NP entrepreneurs where, we can all work together. And one of the areas that we're also putting our energies is in value-based payment and how we get paid, because it's great to have these wonderful businesses, but if you're not going to be paid and reimbursed for it, you're not going to be in business for too long. So so we now are working with some payers and other NPs to look at some opportunities for maybe participating in quality payment programs that CMMI has, and working with some of the insurers in full practice states to maybe, do a pilot program and look at outcomes from nurse practitioner-led practices. So there's a lot of things in the works. We actually have a value-based payment summit coming up in February that will look at engaging NPs and understanding this whole process of value-based payment and how, when we pool our data, we can become aggregators, which is really exciting.
When you talk about value-based paying, can you dive a little bit more into that? Because it's not something I'm particularly familiar with, and I'm wondering if maybe the community at large it doesn't know a whole lot about it.
So value-based payment is actually changing the reimbursement world. So we used to get paid fee for service. So you provided a service, you were paid whatever. And that still does exist, but the transition now is going away from fee for service because it's really not sustainable, and going to value-based payment where you're getting paid for quality care that you provide. And there's hundreds of studies that show NPs provide good, if not better, quality care measures than our physician colleagues, and we do save costs in the long run overall in reducing hospital stays and helping in that transition to care practice when patients are discharged from the hospital to when they see their provider outside of the hospital, because one of the things you want to do is prevent those readmission rates.
Right.
So those quality measures we provide are valuable in the reimbursement world now because Medicare is looking at this. And basically their quality payment program is set up in two tracks, MIPS and then APMs. And you can go onto qpp.gov and look up your NPI and see, are you participating in MIPS or not? Or if you're participating in APMs, because that is what your practices will be getting reimbursed under. So if you are participating under MIPS, then you need to find out what your measures are that the practice is putting value on and seeing, how are your outcomes? And I'm sure your outcomes are going to be outstanding. And there's payment tied to that, and actually increased payment or rewards for providing high quality care. And I don't think a lot of nurse practitioners realize that practices are getting reimbursed higher levels because of quality care that NPs provide.
So then how does the NP take that information and leverage that? Do they go out and say, hey, I want a bonus, or I should be part of your like what do they do with that information?
So first of all, you need to find out about it. So you need to ask questions in the practice. What are the MIPS measures that we're being measured on as a practice? And, what types of measures are being selected? And is it something that is appropriate for a particular practice? And then you can look at what, if they're getting those bonus checks, how is that going to ferret out to you as the nurse practitioner? Because obviously if you're taking care of these patients and you're providing that high quality care, you should reap some benefit from that. So really, it's really asking questions within the practice. And the first one is, how are you billing under my NPI or under the physician NPI? That's the first question you should ask. Even a new grad going in, please ask that question. How are you billing for my services? Will you be billing under my NPI or the physician NPI? Because it's imperative that they bill under yours. You're accountable for what you document, code, and bill.
Because we talked about if they bill under the MD, there's a whole slew of challenges.
It could be, yeah. It could be considered fraud in the Medicare arena, not private insurance, but for Medicare. Those specific criteria outlined earlier are what is going to be looked at. And, what the Office of Inspector General looks at is, did you know knowingly? Are you known, did you know this was happening? And that's when you're going to be held accountable. So if you know it's happening, you need to do something about it. Either go back to the practice and say, hey, this is not right for these reasons. And if they say, well, we're still going to bill that way, then really you need to leave, because now and you're going to be held accountable if for some reason they're investigated. And OIG is going after practices. So don't think it's not happening, because it is.
Okay, got it. But that's only for Medicare, right?
Correct.
So you could bill under, so practices could theoretically bill under the physician for private insurance or anything like that.
They could. However, I would highly discourage that
Okay.
because of these quality measures that all providers are being held to. And we really want nurse practitioners to be um, seen for the quality measures they're providing. And I like the statistic that I hear every year at AANP that we provide 1.06 billion visits per year. And I always like to put the little parentheses, not counting incident two, because it's probably 3 times that number of visits that we're actually providing patients.
Okay, so you're saying that most people are then billing under, so that by that logic, then 2/3 are billing under incident two.
They, they could be, honestly. So that's why I say if you don't know how a practice is billing for your services, you got to ask those questions. It's really important.
Wow, that's. I mean, honestly, like I don't think a lot. I don't think this conversation is. I think one of the frustrations I see is that these conversations are very sort of siloed out. Like you have some of these like industry experts or SME experts, right? So you happen to know a lot about this particular subject. Someone else might know something about another subject, but there's no aggregation model of this, right? Of like where can everyone find all the information they need? Even opening up their own practice in different states. There's no even like standardization there. So is there a solution that's like a pipe dream that you think that you sometimes think about or that you wish could exist? And what would that look like?
That's what NPEN is. That's what we do. We're actually the people that somebody should contact to see if they want to start a business because we if we don't know, we will find the resources to help you. And we've done that before. And we've gotten some MPs out of some pretty interesting situations because of the connections and contacts that we do know. And a lot of the stuff that happens with MPs is really no fault of their own because they just didn't know what they didn't know in formulating their business models. But we do have collaborating physician arrangements as well. So if you need a collaborating physician, we have that. We also have health insurance. So if the MP entrepreneur needs health
Really?
insurance, yes,
Oh,
we
wow.
provide health insurance coverage for the MP and their family. We aren't to the point where we're doing employees yet, but that's hopefully the ultimate goal is to be able to have the practice owners be able to purchase these plans for their employees. But for right now, it's just the MP and their family. And this is one of the reasons why a lot of people start as a side hustle because they are tied to their job because of health insurance.
Yeah.
So hopefully we've tried to alleviate that burden. And we're always open. I mean, people are out there and they might have some things and say, hey, can you focus on this? Or what about this? Or have you thought about that? Let us know because that's what we want to know. We want to know what's out there, what's troubling you, what are some of the frustrations that you have, and how can we help you fix that? Because we want nurse practitioners to build successful, sustainable practices and businesses. Nurse practitioners are going to be the primary care providers of the future. And we've got the momentum now. I mean, the best time to start doing this is now because we actually have the momentum from the year of the nurse and the pandemic. So these are two great things, great opportunities. A lot during bad times, good things happen, and this is one of the things that's happening. A lot of NPs are taking that leap and saying, "Hey, maybe I could do this."
It's interesting. I mean, I agree with you. I think there are a lot of benefits. I think the nurse has really, I don't want to say they've benefited from COVID, but I think a lot of awareness has come into the contribution nurses make in healthcare. And I think overall that's really done a very good thing. Especially because now we're seeing nurses, RNs, NPs get so much more respect and appreciation from the work that they've done in the community.
Yeah.
I think sort of as we're moving into wrapping up, one of the questions, and perhaps this is controversial, but I like to ask it because I think anyone that follows NPHub sort of knows our stance on this. But do you ever think universities will start including business courses or business education for nurse practitioners as standard in curriculum? Like I know a few programs do this. I know FSU does some of this stuff. Northeastern, I know they're pretty forward thinking when it comes to these things. But as a sort of like mass adoption, what's your point of view there, and what do you think will happen?
Well, it's interesting because I think a lot of nurse practitioners now are seeing, like in Connecticut, we have full practice authority. And since that happened in 2014, a lot of NPs have opened up practices. And it's a great opportunity. And I think some students, though not everybody, do have that entrepreneurial spirit, and we don't want to stifle that. We want to create it, we want to foster it, we want to build it. So I do think that we are going to see some partnerships coming down the road and allowing some sort of track or certificate or something that can help those NP entrepreneurs who may want to start a business. Maybe not right when they get out of school, but at least start the framework so they can develop their ideas and get the experience and really be successful.
Yeah, like even a course to potentially like how to review your contract, understanding RVUs, understanding credentialing, like that first walkthrough of maybe that first 6 months of practicing, because you have to get credentialed anywhere you go, correct? Or is it just when you apply, or just when you open your own business?
Well, you get credentialed wherever you work. And most
Okay.
of the practices will do that for you. But when you own your own business, it's you. You're the N of one and you're doing all of this. So you
Right,
have to
right.
make sure you understand that whole process. But I do think that, and it's interesting because we've been asked to provide some education supports, and I've just done some Zoom meetings and live programs with nurse educators in providing some education for their students about entrepreneurship. So, I mean, the doors are opening, and I think that academia is really understanding that this is something that people want, and it's something that they need to hear, and it's very valuable information.
Is there anything that you would recommend nurses do, or an NP does to position themselves well to becoming that business savvy or entrepreneurship savvy NP in their career?
I think the biggest thing is finding a mentor, somebody that you trust and that can provide you with some guidance and support along the way. A lot of times, nurses and nurse practitioners have these great ideas. They come magically saying, I've got a better way to do this, or I think I can do this different, or I can provide patient care differently. And that's what you have to, when that aha moment happens for you, that's when you know you've got something and you should start looking into entrepreneurship.
Got it. So finding mentors can be, exceptionally challenging, right? So I think obviously from the time barrier to just the uncomfortability of going to someone and be like, hey, like, you know what, like, I really respect you in your field and I'd love to learn from you. Those are really uncomfortable conversations to have. I know NPEN offers a mentorship program in terms of helping you find people. Are there any, I guess, when you find an NP that you potentially would want to be your mentor, say you're a fresh graduate, you're a couple years out of school, is there a question or sort of like a few questions you would recommend asking to sort of help facilitate that conversation?
I think the biggest thing is finding somebody that's like-minded to be the mentor. And sometimes myself as a seasoned NP might see something in somebody else that they don't particularly see yet that we can cultivate. So sometimes mentors happen because we see something in a student that possesses us to invest in them. So that's a lot of times how mentorship actually happens. But if you have a great idea and you want to kind of toss it to somebody and see if it's going to work, finding a colleague that's like-minded that can help support that is good. And again, we have support mechanisms as well to help see if this is something that's viable as well. But it's just having that idea, thinking about it, and trying to move it forward. It really does help to have somebody on board that can work with you.
Yeah, someone's feedback you maybe trust, or
Mm-hmm.
someone who's been there that can sort of walk you through some of the pitfalls, right?
And a lot of our NP colleagues that are business owners did it in isolation. I mean, many of these folks have had businesses for 15, 20 years and really didn't have this kind of support and opportunities that these new entrepreneurs have now. So
Yeah.
it's just such an exciting time. I mean, to be able to be supportive of our next generation of business owners it's a thrill. And when people are successful and we see them starting their practices, it's phenomenal. We went down to AAMP Specialty Conference in September in Florida, and we actually got to visit one of our NP entrepreneurs who took our business course and started her practice. And I mean, just the thrill of it felt like, we were seeing our baby go out into the world. And it was just wonderful. I mean, to see
Yeah.
how successful she's become, it's just been phenomenal. And she said it would, if it wasn't for taking the course and, getting that support and really having that camaraderie, she didn't think she could do it.
That's incredible. That's incredible. And I think everything I'm hearing from NPen looks like you guys are really doing a great job on trying to educate people on the topics that aren't discussed, right? And this is the biggest thing. It doesn't sound like this is an organization that is, regurgitating information that's like that's online or anything like that. It's just topics that are not discussed openly. So when you ask someone, how do you learn this? Where do you get this information from? I've literally interviewed other NP entrepreneurs. They say the same thing. They learned it from either a mentor, or they had to Google it on their own, or they figured it out as it went. Not a single person I've communicated with has talked about getting credentialed the minute their business was opened, right? Which is a massive, you can buy yourself 30 to 45 days, 60 days,
Absolutely.
because it costs $100 to open up a company, nothing more.
Right.
So open up a company, start your credentialing process, then start looking for a lease, work on your build out, and you are talking about saving yourself 2-3 months of seeing patients. You can see patients 2-3 months faster. That's a make it or break it for a business in terms of going into debt to generate revenue.
Yeah, and it really depends on the type of practice. I mean, some of these entrepreneurs have fabulous ideas, opening up mobile clinics, doing psych mental health services in the home-based primary care, going to the schools and doing assessments, providing, what was one of the other ones? Somebody who actually started a primary care for a mega church.
Wow.
There's so many opportunities.
That's pretty cool.
People don't realize that there's all these opportunities out there. It's just really taking that initiative and saying, yeah, I can do this, and I now know where I can go to get some help and support and be successful.
1,000%. Lynn, this has been, I think, just an incredible episode talking about the opportunities that are available to NPs. Even just like let that first 20 minutes of talking about, how to, in this sort of way, hack the credentialing process, figuring out the RVU conversation, and talking about like walking through your contracts. Just, I hope you keep talking about it, because I can tell you that there aren't enough nurses talking about this stuff. And from what I've seen, nurses really love learning from other nurses.
Absolutely. And I think it helps when you are aware of what's going on in, Medicare, Medicaid, what's going on in the reimbursement and payment world, because, that's ever changing, and you have to stay on top of these things, because, you need that education. I always learn something every day. I always learn something new. So never stop learning.
No, that's phenomenal. Lynn, thank you so much for being on the podcast today. It was just, honestly, it was enlightening. I think this is going to be like, and it's an hour jam packed with nuggets that you can just listen to and re-listen to again. And I hope our community does that, so they can learn about how to negotiate and figure out your RVUs. That's like,
I want NP practices to take over the world. I mean, that's what I would love to see.
The world or the U.S.?
The world. Let's think big.
Let's think big. I like it. I agree. I think as you get more states adopting independent practice authority, or just lifting some of the restrictions, you're seeing more of it. NPs opening up their own business. It's a good business model, and you see a lot of NPs going into other businesses as well. And I think that's also what I love to see as well.
Yeah, absolutely. And it's interesting because we went to the AAMP conference and we had a booth, and the amount of NPs that came up and said, oh, I have this great business idea. It was phenomenal, because the last time we had a booth in Indianapolis before COVID, nurse practitioners were like, I'm not sure I want to do this. I'm not sure but now it's like, so many people are just so excited about the opportunities that they could do this. And whether you're in a full practice authority, though, that makes it a little easier. Just don't think that, you have to have full practice authority to own your own business, because that's not true. You can open up a practice in other states as well. You just have to know some of the nuances to get through, but it can be done, and your colleagues are doing it. So
that's inspiring. Lynn, thank you so much.
All right. Take care.
Bye.
Appreciate the time. Bye now.